Welcome to ASIO, Fountain of Knowledge. Breast Cancer Myths vs. Facts, Part 2. Unless people experience breast cancer in their own lives, or they're close to someone who does, they might not be able to separate myth from fact when it comes to this disease, who gets it and why, for example, or what treatment involves. True, breast cancer is one of the better known and more talked about cancers, but there are still so many misconceptions out there. This is the second of a two-part video. In this part 2, we will look into the following. Myth: annual mammograms guarantee that breast cancer will be found early. Myth: breast cancer always causes a lump you can feel. Myth: early-stage breast cancer rarely recurs. Myth: all breast cancer is treated pretty much the same way. Myth: breast cancer only happens to middle-aged and older women. Myth: when treatment is over, you're finished with breast cancer. Now, let's go through the list above. Thank you for your attention. Myth: annual mammograms guarantee that breast cancer will be found early. Fact: although mammography is the best early detection tool we have, it doesn't always find breast cancer at an early stage. It's certainly normal to breathe a sigh of relief anytime your mammogram comes back clean. Most women think, "I'm good for another year," and put breast cancer out of their minds. Although mammography is a very good screening tool, it isn't foolproof. It can return a false negative result, meaning that the images look normal even though cancer is present. It's estimated that mammograms miss about 20% of breast cancers at the time of screening. False negative results tend to be more common in women who have dense breast tissue, which is made up of more glandular and connective tissue than fatty tissue. Younger women are more likely to have dense breasts. The reality of false negatives explains why a woman can have a normal mammogram result and then get diagnosed with breast cancer a few months later. Some women can have a series of normal mammograms and still be diagnosed with advanced breast cancer. Also, there are cases where breast cancer develops and grows quickly in the year or so after a true negative mammogram. Mammography does catch most breast cancers, though, and that's why regular screenings are essential. But it's also important to pay attention to any changes in your breasts, perform monthly breast self-exams, and have a physical examination of your breasts by a health professional every year. Myth: breast cancer always causes a lump you can feel. Fact: breast cancer might not cause a lump, especially when it first develops. People are sometimes under the impression that breast cancer always causes a lump that can be felt during a self-exam. They might use this as a reason to skip mammograms, thinking they'll be able to feel any change that might indicate a problem. However, breast cancer doesn't always cause a lump. By the time it does, the cancer might have already moved beyond the breast into the lymph nodes. Although performing breast self-exams is certainly a good idea, it isn't a substitute for regular screening with mammography. There are some other myths about what types of breast lumps are less worrisome, such as, if the lump is painful, it isn't breast cancer, and if you can feel a lump that is smooth, and/or that moves around freely under the skin, it's not breast cancer. Any lump or unusual mass that can be felt through the skin needs to be checked out by a healthcare professional. Although most lumps are benign, not cancer, there is always the possibility of breast cancer. Myth: early-stage breast cancer rarely recurs. Fact: even with early-stage breast cancer, there is always some risk the cancer will return. Many people believe that early-stage breast cancer, cancer that hasn't moved beyond the breast and underarm lymph nodes, has almost no chance of recurring or coming back. Although most people with early-stage breast cancer won't have a recurrence, the risk never goes away completely. Another myth: if the breast cancer doesn't come back within 5 years, it will never come back. While it's true that the risk of recurrence is greatest in the first 2 to 5 years, later recurrences can happen. Because of these myths, some women with early-stage breast cancer report feeling completely blindsided when they have a recurrence. Even at 20 years after diagnosis, people with stage I, low-risk hormone receptor-positive breast cancer have a 15 to 20% chance of recurrence. Recurrent breast cancer can be local or regional, meaning it comes back in the breast or chest area where the original cancer was found, or distant, meaning it comes back in another part of the body, such as the bone, liver, or lungs. Distant recurrence is also called metastatic or stage 4 breast cancer. Myth: all breast cancer is treated pretty much the same way. Fact: treatment plans vary widely depending on the characteristics of the cancer and patient preferences. I had no idea until I was diagnosed how many types of breast cancer there are, nor did I know anything about the different types of treatment, noted a survivor. Many people have some vague idea that breast cancer requires some combination of surgery, radiation therapy, and maybe chemotherapy, but they don't know much beyond that. They might not realize that they can speak to 5 different people with breast cancer and discover that they have 5 different treatment plans. This is because each person's treatment plan really is tailored to his or her needs. So many different factors can come into play when choosing treatments. Myth: breast cancer only happens to middle-aged and older women. Fact: younger women can and do get breast cancer, as do men. It is true that being female and growing older are the main risk factors for developing breast cancer. In 2017, about 4% of invasive breast cancers were diagnosed in women under age 40, while about 23% were diagnosed in women in their 50s and 27% in women ages 60 to 69. While 4% might sound small, it isn't zero. This percentage means that 1 in every 25 invasive breast cancer cases occurred in women under 40. Women of all ages need to pay attention to their breasts, perform self-exams, and report any unusual changes to their doctors, and insist that breast cancer be ruled out if there's a concerning symptom. Even some doctors buy into the myth that women in their 20s and 30s don't get breast cancer. Women with a strong family history of breast cancer, especially cancers diagnosed in relatives before age 40, may wish to start screening sooner. Breast cancer is even rarer in men, but it does happen. People often think that men can't get breast cancer because they don't have breasts, but they do have breast tissue. Male breast cancer accounts for less than 1% of all breast cancers diagnosed in the US in 2019. About 2,670 men are expected to be diagnosed with the disease. Even though male breast cancer is rare, it tends to be diagnosed at a more advanced stage because breast changes and lumps typically don't lead men and their doctors to think breast cancer. Changes in male breasts need to be checked out, too. Myth: when treatment is over, you're finished with breast cancer. Fact: breast cancer can have a long-term impact on people's lives and well-being. People with breast cancer often report that their family and friends expect them to be ready to move on after treatments such as surgery, radiation therapy, and chemotherapy end. In reality, targeted therapies such as Herceptin, chemical name, trastuzumab, may be prescribed for a year or more. Hormonal therapies, such as tamoxifen and aromatase inhibitors, are often prescribed for up to 10 years. If a woman has decided to have her breasts reconstructed, this may require a series of surgeries over several months. And for those with metastatic or stage 4 breast cancer, treatment will last for the rest of their lives. Even after main treatments are done, people can experience long-term side effects. Some of these side effects can be physical: pain and tightness, fatigue, skin changes, neuropathy, tingling and numbness in the hands and feet, menopausal symptoms, and others, depending on the treatment regimen. Other side effects can be mental and emotional, anxiety, fear of recurrence, and relationship changes, among others. For many people, the effects of the breast cancer experience last for years, or for life, in the case of metastatic breast cancer, but their loved ones just don't get it. A survivor said, "People think that, after you are cured, you will return to normal, like you never had cancer." Another points to an all-too-common reaction she encounters: "You are done with surgery/radiation/chemo, well, then you are fine now, right?" Who out there knows that so many of us, even early stagers, are on meds for 5 or 10 years, and that these meds may have significant health and quality of life side effects? Thanks for listening and watching. Kindly share the link for this video. Also, Remember to like and subscribe to our channel Azio.